For 8 long years, this government has said no to ratios. On Sunday, 5 weeks out from a state election, the New South Wales Liberal Nationals announced a promise to fund 5,000 extra nurses and midwives over the next 4 years. But they still say no to ratios. The only way to guarantee those nurses and midwives will be delivered to the bedside is through mandated ratios on every shift, every ward, including emergency departments and postnatal. There's no question that this announcement was prompted by our campaign for ratios. We know the current system is failing nurses and midwives. We know numbers aren't enough if they aren't mandated by law in our award. 5,000 is a big number, and we'll be asking for more detail on their announcement. However, these will not be delivered by mandated ratios on every shift and ward. Your campaigning efforts are making a difference. 1 hour after the Liberal National announcement, New South Wales Labor matched those numbers of 5,000 and restated its commitment to introduce a new shift-by-shift nurse-to-patient ratio system into the award starting in July 2019. What a great position to be in. Decision makers are finally listening to what nurses and midwives have been saying for years. The campaign is far from over. Continuing with the current nursing hours per patient day is crippling our health system. An assurance to include minimum mandated ratios will end the manipulation of the current rostering system and support a clear and transparent staffing system. Patients are missing out on nursing and midwifery care. We uncovered over 40,000 hours of missed clinical nursing care in 18 hospitals due to non-compliance with the nursing hours per patient day system. The Liberal National Government's announcement to fund the recruitment of additional nurses and midwives does not address these systemic flaws. Any commitment of extra nurses and midwives must include minimum mandated ratios, a shift-by-shift ratio system that will give nurses a clear understanding of how many patients they have to care for at all times of the day, removing the loophole to average hours over an entire week. Ratios is a staffing model we know works. It's successful overseas and already in operation in Victoria and Queensland. More staff are always a benefit, but if we don't tackle the staffing issues from the root of the cause, we risk a continuation of a flawed system. The only way to deliver safe patient care is through minimum nurse-to-patient ratios on every shift, every ward. It's disappointing that the Liberal National Government has chosen to ignore the need for a clear and accountable system. It's our job as your representatives to continue negotiations with both parties. We're already seeking further detail from the Liberal National Government on its announcement, and we'll have more discussions with the New South Wales Labor Party. I'd like to take this opportunity to thank all of those members who have advocated tirelessly for better staffing in our public hospitals. We are finally getting the attention we deserve from the decision makers. We're so close to achieving what we've been fighting for. So let's keep up the collective pressure, and on 23 March, vote for ratios.